A retired schoolteacher from Ohio. Sharp, independent. The kind of woman who walked 2 miles every morning and never missed a grandchild's birthday. One Tuesday in October, she noticed something in the bathroom. Her urine looked different, darker than usual, almost the color of tea. She told herself it was probably nothing. Maybe she hadn't drunk enough water that day. She'd been a little tired lately, but who isn't tired at 67? She ignored it for 3 weeks. When she finally mentioned it to her daughter, not even to a doctor, just her daughter, and her daughter pushed her to get checked, the test results changed everything. Her liver was in serious distress, a condition that had been building quietly for months, and her urine had been trying to tell her for weeks before any other symptom appeared. That is the story nobody tells you about your urine. It is not just waste. It is not just water your body is getting rid of. It is a daily report card, a biological window into what is happening right now in your kidneys, your liver, your blood, and your immune system. And most people over 50 glance at it and flush without reading a single word of that report. Today, we're going to change that. We're going through 6 specific urine colors and what each one is trying to tell you. The science behind every single one. The moment each one stops being something to ignore and becomes something to act on. And by the end of this video, you will never look at your urine the same way again. Stay through all 6, because sign number 4 is the one that sends more seniors to the emergency room than almost anything else. And the majority of them had no idea it was coming. Welcome. This channel is built on one simple commitment: taking real research, peer-reviewed studies, published clinical data, evidence-based medicine, and putting it in plain language that actually helps you protect your health after 50. No scare tactics, no selling anything, just the information your body deserves. If this is your first time here, hit subscribe. We go this deep every single day. And if someone you care about is over 50, share this video with them. What we are about to cover could genuinely save a life. Let's get into it. Before we go through the 6 signs, you need to understand something that most people were never taught. Most people think urine is simply excess water leaving the body. That is not even close to the full picture. Every single minute of your life, your kidneys are performing one of the most complex filtration processes in all of human biology. Right now, as you're watching this, your 2 kidneys are filtering your entire blood supply, approximately once every 30 minutes. Think about what that means. Every 30 minutes, every drop of blood in your body passes through the kidneys. The kidneys sort through everything: waste products, excess salts, metabolic byproducts, damaged proteins, cellular debris, and decide what stays in the blood and what gets sent out through the urine. What comes out in your urine is therefore a direct reflection of what was found in your blood. If your liver is struggling, the chemical evidence appears in the urine. If your kidneys are losing their filtering precision, the evidence appears in the urine. If your immune system is fighting an infection, the evidence appears in the urine. If your body is severely short on fluids, the evidence appears in the urine. Urine is not waste. Urine is a messenger. And the color, that simple, observable thing you can check in under 3 seconds every single day, is one of the most immediate and accessible signals that messenger can send. The pigment that gives urine its yellow color is called urochrome. It is a byproduct produced when your body breaks down old red blood cells. The more diluted your urine is, meaning the more water it contains, the lighter and more transparent that yellow becomes. The less water it contains, the more concentrated the urochrome, and the darker the yellow. That is the baseline, pale straw to light golden yellow. That is what a well-functioning, well-hydrated body produces. Everything beyond that baseline is information. And here is what makes this particularly important after 50. Research published in medical journals shows that older adults have a reduced sense of thirst compared to younger people. Their thirst mechanism becomes less sensitive with age. That means by the time you feel thirsty at 60 or 70, your body may already be significantly dehydrated. Your urine color will tell you this before your thirst does. Every single morning. So let's go through the 6 signs, starting with the most common and building toward the most serious. Sign 1. Deep dark yellow or amber urine. Let me tell you about something that happens to millions of people over 50 every single morning. They wake up, they go to the bathroom. Their urine is dark, almost orange-yellow, heavy-looking. They think, oh, I just need some coffee, and they move on with their day. What they're looking at is concentrated urine. And what concentrated urine means consistently is that their body spent the entire night in a mild state of fluid deficit. Here is what happens physiologically. When your body is low on fluids, the brain sends a signal to the kidneys through a hormone called antidiuretic hormone, also called vasopressin. That hormone tells the kidneys to conserve water, to take every last drop they can from the urine before releasing it. The result is urine with very little water content and very high concentrations of urochrome, waste salts, and metabolic byproducts. It is dark. It is concentrated. It sometimes has a sharp ammonia-like smell. In a young, healthy adult, this happens occasionally. The body corrects it quickly with a glass of water. But here is where this becomes a senior health issue specifically. Research from the National Institutes of Health confirms that adults over 60 are at significantly higher risk of chronic low-grade dehydration. Not dramatic collapse in the heat dehydration, the quiet kind. The kind that persists day after day because the thirst mechanism is no longer reliable. Published research shows that dehydration prevalence in community-dwelling older adults in the United States ranges from 17% to 28%. Nearly 1 in 3 seniors regularly dehydrated without knowing it. And the consequences of that chronic low-grade dehydration are not trivial. Studies show it is directly linked to cognitive decline, increased fall risk, urinary tract infections, kidney stone formation, and longer hospital recovery times. All from something your urine tells you every single morning before you've had a sip of water. The rule is simple. Your first urine of the morning is always more concentrated. That is normal because your body conserves water during sleep. But your urine by mid-morning, after you have had fluids, should be a pale, light yellow. If it is still deep amber at 10 a.m., drink more water. When does this become urgent? If your urine is dark amber and you notice reduced urine output, meaning you're going significantly less often than usual, alongside dizziness or confusion, that is a dehydration emergency, particularly in warm weather. For seniors, that combination can escalate to hospitalization in hours. Sign 2. Orange urine. Orange urine is the sign that most people dismiss the fastest. Because most people have heard that certain vitamins, especially B vitamins, particularly riboflavin, can turn urine bright orange or yellow. And that is absolutely true. If you take a multivitamin, you have probably seen this. So people assume orange urine is always the vitamins. And sometimes it is. That is important to acknowledge. But here's what the research tells us about orange urine when no vitamins or supplements are involved. When orange urine appears on its own, especially when it persists over several days, it is frequently a sign that something is happening in the liver or the bile system. Let me explain the mechanism, because this is where it gets important. Your liver produces a substance called bile, a digestive fluid that helps break down fats in your intestines. Inside bile is a pigment called bilirubin. Bilirubin is produced naturally when your body breaks down old red blood cells. In a healthy liver, bilirubin is processed, packaged into bile, sent to the intestines, and eventually eliminated from a body in stool. This is what gives stools their normal brown color. When the liver is struggling, whether from inflammation, early hepatitis, bile duct blockage, or fatty liver disease, bilirubin begins to back up. It cannot be processed fast enough. It overflows into the bloodstream. And when the kidneys filter that excess bilirubin out of the blood, it appears in the urine. It turns it orange. This is a sign of the body trying to manage a liver that is under stress. What makes this sign particularly important after 50 is this: non-alcoholic fatty liver disease, a condition where fat accumulates in the liver tissue over years, is now estimated to affect approximately 25% of the global adult population. Many people over 50 have some degree of it without knowing it, because in its early stages it causes almost no symptoms. Orange urine, Persistent orange urine, combined with pale or whitish stools, is one of the earliest visible signals that the liver is struggling with bilirubin processing. There is one additional sign to look for alongside orange urine. Look at the whites of your eyes. Look at your skin. If either is taken on a slightly yellow tinge, that is jaundice. And jaundice plus orange urine together is a combination that should bring you to medical attention the same day. The bottom line on orange urine asterisk. One morning after a multivitamin? Normal. Persistent. Recurring. No supplement explanation? A conversation with your healthcare provider and a liver function blood test, called a hepatic panel, is warranted. Sign 3. Pink or red urine. This is the sign that should never be dismissed. Let me be very direct here before we go into the science. If you see pink or red urine and you have not eaten beets, blackberries, or rhubarb in the last 24 hours, that is blood. And blood in the urine is a medical finding that always deserves investigation. Always. The medical term for blood in the urine is hematuria. And here is what makes it so important to understand. Hematuria does not always mean something catastrophic. There's a long list of causes, some minor, some serious. But among people over 50, the causes that cannot be ignored include kidney stones, urinary tract infection, an enlarged prostate in men, chronic kidney disease, and in a smaller but significant percentage of cases, bladder or kidney cancer. Here is the statistic that should make every person over 50 take this seriously. Bladder cancer is the 4th most common cancer in men in the United States. And its most consistent early sign, the one that appears before pain, before urgency, before any other symptom, is blood in the urine. Painless, not accompanied by burning, just a quiet change in color. Research published in urology literature confirms that painless hematuria in adults over 50 is considered a red flag symptom until proven otherwise. It does not mean you have cancer, but it means that possibility needs to be ruled out with testing. Let me tell you why the painless part is so critical. People wait for pain as their signal to act. If it doesn't hurt, they convince themselves it isn't serious. But bladder cancer in its early, most treatable stages frequently produces hematuria with no pain whatsoever. The tumor is growing quietly. It is disturbing blood vessels in the bladder lining, and the only evidence is a slight discoloration in the toilet bowl. By the time pain arrives, the disease is often further progressed. Here is the process of elimination that research supports. If you see pink or red urine, first ask yourself, did I eat beets, blackberries, or rhubarb in the last day? Some people experience a harmless phenomenon called bituria, where beet pigments pass into the urine. Am I taking rifampin, phenazopyridine, or certain laxatives? These medications can produce reddish urine. If the answer to both questions is no, or if the discoloration persists more than 24 hours after ruling those out, that is the moment to seek evaluation. Not tomorrow. Today, a simple urine dipstick test, available at any clinic, can confirm the presence of blood in minutes. One additional cause of red-brown urine after 50, worth knowing. A condition called rhabdomyolysis, meaning rapid breakdown of muscle tissue, can turn urine a dark red-brown, almost the color of cola. This can happen after extreme overexertion or heat exhaustion. If you have been exercising intensely or in extreme heat, and your urine turns this color, that is a medical emergency. Rhabdomyolysis can lead to acute kidney failure if not treated promptly. Sign 4. Cloudy or murky urine. This is the sign that sends more seniors to the emergency room than almost anything else on this list. And the reason it is so dangerous is not what the urine looks like. It is what happens when people ignore what it looks like. Cloudy urine has several possible causes, and sorting through them matters enormously. The most common cause, and the one you should consider first, is a urinary tract infection, a UTI. In younger adults, a UTI is relatively straightforward. There is burning, there is urgency, there is frequency. The symptoms are loud, uncomfortable, and impossible to ignore. In adults over 65, a UTI can be almost silent in terms of urinary symptoms. The burning may be minimal. The urgency may be dismissed as just my bladder acting up again. But the infection is still there, still progressing. And in the urine, cloudy, murky, sometimes foul-smelling, the signal is being sent. Research from Cleveland Clinic shows that UTIs are among the most commonly diagnosed infections in older adults. For women over age 65, the UTI incidence rate exceeds 10%. For women over 85, it approaches 30%. Now here's the part that makes this a genuine emergency risk. In seniors, an untreated UTI does not just stay in the bladder. It can ascend to the kidneys, producing a kidney infection called pyelonephritis, which carries symptoms of high fever, back pain, and severe illness. And beyond that, in older adults with any immune vulnerability, a UTI can progress to sepsis, a life-threatening infection of the bloodstream. Sepsis in seniors over 65 carries a mortality rate that clinical research consistently documents as being significantly higher than in younger adults. But here's the twist that makes cloudy urine in seniors even more complicated. Some older adults with active UTIs, particularly those with any degree of cognitive impairment or early dementia, do not present with urinary symptoms at all. Instead, they develop what clinicians call atypical presentation. The signs of infection in the brain appear first. Sudden confusion, new disorientation, agitation. A senior who is clear-minded the day before suddenly seems foggy, unlike themselves. If you or a family member over 65 experiences sudden unexplained confusion, and the urine looks cloudy or smells strongly, that combination warrants immediate medical evaluation. Not watchful waiting. Immediate evaluation. Beyond UTI, what else does cloudy urine signal? Cloudy urine can also indicate kidney stones, particularly when the cloudiness is accompanied by flank pain or blood. It can indicate protein in the urine, which we will cover more in Sign 5. And in some cases, it can indicate sexually transmitted infections or inflammatory conditions affecting the urinary tract. The rule: cloudy urine that persists beyond 24 hours, especially when accompanied by any change in how you feel, fever, pain, unusual fatigue, or mental fogginess, deserves a urine test. Sign 5. Foamy or frothy urine. I want to start this section with something important. If you flush your toilet very forcefully, the impact of urine hitting the water can create temporary bubbles. If you urinate with a strong, fast stream, you can create temporary foam. This is normal. Those bubbles disappear within a few seconds. That is not what we are talking about. What we're talking about is persistent foam, bubbles that look like the head on a beer. Foam that stays in the bowl for 30 seconds, a minute, even after you flush. Foam that appears consistently, morning after morning. That kind of foam has a specific medical explanation, and it is one of the most important early warning signs of kidney disease. Here's why. Your kidneys are built, at their core, as a precision filtration system. Inside each kidney are approximately 1 million tiny filtering units called nephrons. Each nephron contains a microscopic filter called a glomerulus. These filters are designed to be size-selective. Large, valuable molecules like proteins cannot pass through them. Only small waste products, excess salts, and water pass through into the urine. Protein, especially albumin, the main protein in your blood, stays in the bloodstream where it belongs. When those filters become damaged, that size selectivity breaks down. Protein molecules begin slipping through. They appear in the urine. And protein in water creates foam, for the same reason that shaking a glass of milk creates foam. Protein molecules are structurally designed to create stable bubbles in water. The medical term for this is proteinuria. And proteinuria is considered one of the earliest detectable markers of kidney damage. Research published in the medical literature confirms that more than 1 in 7 U.S. adults has chronic kidney disease, and the majority are unaware of it. After 50, the kidneys naturally lose some of their peak filtering efficiency. High blood pressure, which affects millions of seniors, places sustained pressure on those delicate nephron filters over years. Elevated blood sugar, from diabetes or prediabetes, also damages the tiny blood vessels that supply the nephrons. The result: filters that slowly begin to leak protein. Persistent foamy urine can be the first sign of this process. Before any blood test flags a problem, before any symptoms appear, just foam in the toilet that you might be tempted to ignore. A published clinical study found that in a group of patients complaining of foamy urine, a meaningful percentage were found to have significant proteinuria, early kidney damage markers, on formal testing. Here is the actionable information. 1 foamy morning? Probably your stream speed. No concern. Consistently foamy urine, week after week? Request a urinalysis with protein measurement. A simple urine dipstick can detect protein in minutes. If protein is confirmed, a follow-up test called a urine protein-to-creatinine ratio provides more precise measurement. Early proteinuria, caught early, can be managed. Kidney filters that are 80% damaged cannot be restored. The same filters at 15% damage can be protected and preserved for years with the right interventions. This is a sign worth taking seriously, not with fear, with action. Sign 6. Dark brown or cola-colored urine. We have arrived at the final sign, and it is the darkest one in every sense of that word. I want to tell you about Robert. Robert was 71, a former engineer, precise, analytical, someone who liked to understand how things worked. He had been taking a cholesterol medication for about 2 years. One week, he noticed his urine had turned a strange dark brown. Like tea, like cola. He drank more water. It didn't clear. He thought maybe he was dehydrated. He drank even more. Still dark. On the 4th day, he told his wife. His wife called their healthcare provider immediately. The blood test results came back. His kidneys were under acute stress. The cause, his cholesterol medication, at the dose he was taking, combined with a recent week of intense yard work in the heat, had triggered a condition called rhabdomyolysis. The muscle breakdown had flooded his kidneys with a protein called myoglobin that was essentially poisoning the filtration system. Robert caught it in time. 4 days of hospital-based hydration. Full kidney recovery. If he had waited another week, the outcome could have been permanent kidney damage. Dark brown or tea-colored urine is one of the most serious urine color changes on this list, and it has 3 distinct possible causes, each one serious in its own right. Cause 1. Severe dehydration. When the body is severely dehydrated, beyond the mild dark yellow we discussed in sign 1, urine can become dark brown. At this level of dehydration, the kidneys are pulling so much water back from the urine that what remains is an intensely concentrated mixture of waste products and cellular byproducts. Alongside the color, severe dehydration at this level often produces significantly reduced urine output. You're going much less often, and what comes out is very dark and very small in volume. Cause 2. Liver disease. When the liver is severely compromised from hepatitis, cirrhosis, or advanced fatty liver disease, bilirubin floods the bloodstream in large quantities. The kidneys filter out as much of it as they can. Large amounts of bilirubin in the urine turns it a distinctive tea or cola color. This is often accompanied by yellowing of the skin and eyes, jaundice, and pale, clay-colored stools. That combination, dark urine, pale stool, yellow tinge to the skin, is what clinicians call a classic liver disease triad. If you observe all 3 together, that is a same-day medical evaluation. Cause 3. Rhabdomyolysis. This is the cause that affects seniors in a way that almost nobody warns them about. As Robert's story showed, rhabdomyolysis, the rapid breakdown of muscle tissue, can be triggered in older adults by intense physical overexertion, prolonged heat exposure, certain medications including statins, cholesterol drugs, which millions of seniors take, or a combination of any of these. When muscle tissue breaks down rapidly, it releases a protein called myoglobin into the bloodstream. Myoglobin is normally found inside muscle cells. It has no business being in the blood at high concentrations. When the kidneys try to filter it out, it damages the kidney tubules, the tiny channels that process filtered blood. In severe cases, this can precipitate acute kidney failure within days. The published research on rhabdomyolysis notes that statins, one of the most widely prescribed medications in senior populations, carry a risk of triggering this condition, particularly at higher doses during illness or combined with intense physical activity. The signal in the urine is unmistakable, dark brown or cola-colored, often with muscle pain or extreme unexpected fatigue. The rule for dark brown urine is the simplest rule in this entire video asterisk. Dark brown urine that does not clear after drinking one large glass of water and waiting 2 hours is not a wait-and-see situation. That is a call your provider today situation. Always. You now have the complete picture. 6 signs. The science behind every one. The moment each one goes from information to action. Now let's make this practical. 3 things you can begin today. First, the morning urine check. Make it a habit. Every morning, before you flush, take 3 seconds. Look at the color. Compare it mentally to the pale straw that represents healthy and hydrated. Your morning urine will naturally be somewhat darker. That is normal after a night of sleep. But if you're consistently dark amber at your second or third bathroom visit of the day, your hydration needs attention. Second, know your personal baseline. For 1 week, pay attention. Get familiar with your normal. What does your urine typically look like? Because the changes, the ones that mean something, are changes from your baseline. When something looks different from your usual, that is the signal to pay closer attention. Third, know the 4 colors that warrant action without delay. Red or pink with no dietary explanation. Same-day evaluation. Persistent dark brown, call today. Persistent foam week after week, request a urine protein test. Cloudy with confusion or fever in a person over 65, immediate care. These are not reasons to panic. They are reasons to act. And early action is where better outcomes begin. Your body has been communicating with you every single day of your life. Every single day, it has been sending signals, leaving messages, trying to get your attention through every channel it has. We're so busy. We are so used to flushing and moving on. We are so conditioned to ignore the quiet signals and wait for the loud ones. But the quiet signals are where the real opportunity lives. The loud ones come later. The quiet ones, like a color that seems a little off, a foam that seems a little persistent, a darkness that doesn't quite clear. Those are the ones that catch things early. And catching things early is everything. The research is not ambiguous on this. Across kidney disease, liver disease, UTI complications, and bladder cancer, earlier detection consistently and significantly improves outcomes. Your urine is not waste. It is a message. Read it. If this video gave you something useful today, a new habit, a new awareness, something worth sharing, please subscribe. Every week, we go this deep on the health topics that matter most after 50. Research-based, plain language, built for you. And leave a comment below. I want to know, which of these 6 signs have you seen and never connected to something deeper? Your experience might be the exact thing someone else needs to read today. Take care of yourselves. I'll see you in the next one.